services remains limited. Now, to combat this, Next Biosciences is expanding its offerings. Let's find out more from Ashley Buchanan, Head of Reproductive Health at the company. Ashley, good morning. Thank you for your time on eNCA.
Good morning. Thank you so much for having me.
Ashley, as I just said, infertility affects up to 1 in 5 couples. What are some of the key factors driving this rise, and how does it compare to global trends?
It's a great question. I think locally we are seeing, we are really tracking the international trends, so local is no different. The things that contribute to the rise in infertility rates are things like delayed childbearing, whereby individuals are choosing to have children later in their life due to career or financial or even personal reasons. Typically, fertility will naturally decline with age, particularly for women over the age of 35 years old. Then you get things like lifestyle factors, poor diet, obesity, malnutrition, excessive alcohol consumption and smoking. Poor lifestyle factors have been known to impact things like sperm quality and sperm count, particularly in men. You get things like environmental pollutants and increased exposure to what we call endocrine disrupting chemicals that are typically found in plastics, pesticides, and industrial waste. These things can interfere with hormone regulation and infertility. And then, of course, something that I think many of us are very aware of and very familiar with is increased stress levels, the pressures of modern life, including financial strain, and work-related pressures can disrupt this hormonal balance and affect ovulation and sperm production in the reproductive system.
Now, Ashley, there's often a stigma around infertility and reproductive health, which is why some people don't even want to talk about it. In some cultures in South Africa, we don't even want to talk about it. What are some of the most common misconceptions, and how do they impact those struggling to conceive?
You're absolutely right. There is a stigma, and it's exactly why conversations like this are so important. So thank you for having this conversation with me. So there's a lot of misconceptions around reproductive health. To name a few, one of the main ones that we're looking to combat is the notion that infertility is only a woman's issue. This is particularly relevant and rife in South Africa, where male infertility factors are not openly discussed. When in fact male infertility contributes to 40 to 50% of all infertility issues. So it really is a half-half situation. Another misconception that we work to fight is the notion that if you're healthy, you won't have reproductive issues. This is simply not true. Things like PCOS and endometriosis, these things, despite how healthy the individual is, will impact their fertility. And then we've got things like a really relevant, I think, and surprising misconception is that age only affects female fertility. Whilst obviously female fertility has got a biological clock that's ticking, absolutely. We have seen evidence come out that male fertility also declines with age and also impacts things like sperm quality, increasing the risk of genetic issues.
Let's talk about the cost attached to treatments, because we often find people, they don't even want to go and consult because we already have the idea in our mind that I won't be able to afford it in any case. With treatments like IVF, for instance, IUI being so costly, how is Next Biosciences working with medical aids and offering payment plans to improve accessibility for couples struggling with infertility? What solutions are you offering?
So cost is always a factor. We are a third world country, so access to these world-class services is always going to have cost as an element. I think when from a Next Biosciences perspective, it's a team effort. We will continue to and kind of constantly lobby with the medical funders to try and get better coverage for this type of testing and for IVF in general. We're slowly making progress. Some of the medical aids are getting on board with covering things like IVF and IUI. So we are making progress on that front. We will also continue to lobby with the state sector and try and get advocacy for IVF and things like reproductive health and fertility-based care and fertility-based coverage. Aside from that, what we can do from an immediate perspective that isn't quite as long-term as lobbying and kind of fighting the good fight with the medical funders is Next Biosciences offers payment plans for a lot of our testing. The point of it is just to try and make the cost of these tests more manageable, more bite-sized, so that hopefully cost is no longer a factor. Really, the ultimate goal is for everyone to have equal access and for cost to not be a factor in the access.
Now, your research also highlights the importance of early intervention when it comes to fertility care. What are some key steps that individuals can take to better understand and manage their reproductive health?
So I think early intervention, absolutely. I think in healthcare, this is rather be proactive than preventative, or rather be proactive than reactive. So I think, some of the key steps is really to see your doctor, your gynecologist, your obstetrician, your urologist, before you suspect there's something wrong. So I think a lot of people will only go and see a doctor or seek medical help when they feel like there's something that's gone wrong. However, it's really important. A lot of these things are asymptomatic, so you won't necessarily realize that you have got a reproductive health issue until it's a little bit too late. So seeking medical care as early as possible and just having the right conversations, educating yourself on what's out there, and making sure that you are seeking medical care before you're symptomatic or before you feel like there's something wrong.
Now, Ashley, as you said, you guys are trying to make it easier, more affordable and accessible for South Africans, these kind of treatments that are necessary. Next Biosciences has, of course, expanded its reproductive health services, and that includes carrier screening, endometrial health testing, and the mini-me fetal sex test as well. Please help us understand how these innovations help address infertility challenges, just briefly.
Sure. So things like the endometrial health test that we offer, if you think of your endometrium as your little house that houses your pregnancy and houses that embryo for the perfect implantation, specifically during IVF, the type of testing we offer basically tests this little house that offers or that kind of protects that pregnancy to make sure that the house is symbiotic and is ready for hosting a pregnancy to term. So that's endometrial health. From a carrier screening perspective, many conditions such as cystic fibrosis, sickle cell disease, Tay-Sachs disease are caused by what we call recessive mutations or recessive gene mutations. In other words, a child must inherit a copy from both their parents in order to inherit this disorder. As a result, there's many people out there that are carriers for these disorders, but they are totally unaware of the fact that they are carriers.
Yeah.
By testing both parents in a relationship, we will be able to ascertain the risk of the child inheriting these disorders.
Okay.
And then as for our mini-me fetal sex test, this is a in-house developed test. We developed it in-house and we did all the research in-house. And really it enables parents to ascertain the gender of their pregnancy from as early as 10 weeks.
Well, thank you so much for all the insights shared today. I'm sure those of our viewers who would like more information can head over to your website, Next Biosciences. That is, thank you so much, Ashley Buganon, the head of reproductive health at Next Biosciences. We appreciate her time. Now it's time to see what's happening in the world of sports. Over to you, Nicole Kente.